All right, we're live. And we're just going to wait another few seconds, Julie. Thank you.
Hi there. Sorry about the confusion. I'll just rename myself. My colleague was on my station.
Oh, thank you so much, Sabrina. We're just about to go live here. Thank you so much for joining.
Marianne here.
Good afternoon, bon après-midi à tous. My name is Julie Turcotte and I will be your moderator for today. Je m'appelle Julie Turcotte et je serai votre modératrice aujourd'hui. Thank you for joining us for today's media availability on COVID-19. Merci de vous joindre à nous pour ce point de presse au sujet de la COVID-19 aujourd'hui. To view who's speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located on the top right corner of the Zoom video screen. Veuillez changer votre écran au mode speaker en anglais pour mieux voir vos porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin our interpreters, Marianne and Yvon, or follow along on our YouTube link. Des journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes Marianne ainsi que Yvon ou suivre la diffusion sur YouTube. Today, we will be hearing remarks from Dr. Brent Mallochny, Deputy Medical Officer of Health with Ottawa Public Health. Aujourd'hui, notre porte-parole sera le Dr. Brent Mallochny, médecin-chef adjoint en santé publique avec Santé publique Ottawa. Following remarks, we will take questions from the media. A friendly reminder to please keep your microphone on mute until I invite you to ask your question. Veuillez désactiver votre microphone jusqu'au moment de poser votre question. Je passe maintenant la parole au Dr. Mallochny. Dr. Mallochny, over to you.
Great. Thank you, Julie, and good afternoon. Bonjour, Kwe. As the return to school and in-person learning approaches, Ottawa Public Health remains committed to supporting schools to stay open and to maintain a safer environment for students and staff. As a community, we need to continue to do our part to keep COVID rates down so we can keep the virus from being introduced into school settings. Ottawa Public Health will continue to support the school community with public health nurses on site in schools, online, and over the phone to support COVID-19 prevention and protection measures. This includes supporting the implementation of guidelines and policies to ensure everyone practices preventive measures, such as daily screening before attending school, proper masking, distancing, and hand washing. Santé publique Ottawa continuera de soutenir la communauté scolaire grâce à la présence d'infirmières en santé publique dans les écoles, en ligne et par téléphone, afin de soutenir les mesures de prévention et de protection contre la COVID-19. We've heard from parents and understand your concerns about possible cases in schools. If there's a student or staff who's identified as testing positive for COVID in a school, OPH will ensure quick identification of cases and contacts, assess vaccine status, and isolate individuals to reduce risks. Those who are fully vaccinated and not having any symptoms can remain in school in keeping with provincial guidance. Ottawa Public Health will continue to send a general notification to the school community and an automated message to those identified as high-risk contacts. Please review these OPH messages carefully if you receive them and follow the instructions provided. Si un élève ou un membre du personnel est identifié comme ayant un résultat positif au test pour la COVID-19 dans une école, Santé publique Ottawa veillera à identifier rapidement les cas et les contacts, à évaluer le statut vaccinal et à isoler les personnes pour réduire les risques. We are also working with community health partners, including CHEO, to ensure ready access to testing, including increasing availability of take-home testing kits in many schools. We continue to monitor the local COVID-19 situation and will adjust our recommendations to school boards to ensure the school setting is as safe as possible. This pandemic has been challenging for our children and youth, and as students transition to in-person learning, Ottawa Public Health continues to work with mental health partners in schools to connect students and families to supports and help schools to foster mental health and promote resilience. Visit our website for information and resources to support children's mental health. Over the past few weeks, we've been hearing of more organizations and workplaces implementing vaccination policies. Ottawa Public Health welcomes these steps taken by local organizations and strongly recommends that all those eligible receive both doses of the COVID-19 vaccine. Supporting employees to get fully vaccinated is the best way to help protect them from the risks of COVID-19, prevent outbreaks, and build confidence in the workplace as we continue living with this virus in our community. OPH continues to engage with local organizations to ensure employers and employees are provided information about the benefits of vaccination, where to get vaccinated, and encourage that employees are provided with time off to get their vaccinations. A reminder that workplaces, community organizations, places of worship, and other groups can contact Ottawa Public Health to request a mobile vaccination team to administer first and second doses of the COVID-19 vaccine on site at their own location. Please visit our website or call us at 613-580-6744 to make a request. Nous rappelons que les lieux de travail, les organismes communautaires, les lieux de culte et d'autres groupes peuvent communiquer avec Santé publique Ottawa pour demander qu'une équipe mobile de vaccination administre la première et la deuxième dose de vaccin COVID-19 sur place dans le locaux. Pour faire une demande, appelez le 613-580-6744 ou visitez notre site web. Following last week's announcement by the province, a third dose of the COVID-19 vaccine is now available to residents most at risk of serious illness, including individuals who are severely immunocompromised. This includes transplant recipients, patients with hematological cancers on active treatment, and recipients of an anti-CD20 agent. Suite à l'annonce faite la semaine dernière par la province, une troisième dose de vaccin contre la COVID-19 est maintenant disponible pour les résidents les plus à risque de maladies graves, y compris les personnes gravement immunodéprimées. Residents who meet these criteria can speak to their specialist or hospital program to ask for a letter to receive a third dose. Now, the third dose will be given at least 2 months after the second dose and will be the same vaccine received as the second dose. Drop-in vaccinations are available to those eligible for the third dose at any community clinic, pop-up clinic, or neighborhood vaccination hub in Ottawa during hours of operation. Eligible residents must present a letter from their specialist or hospital program to receive a third dose. Les résidents qui répondent à ces critères peuvent s'adresser à leur spécialiste ou au programme de leur hôpital pour demander une lettre pour permettant de recevoir une troisième dose. Now, residents of long-term care homes and highest risk retirement homes will also be offered a third dose of vaccination at an interval of at least 5 months after the second dose. Ottawa Public Health is working with long-term care homes and highest risk retirement homes directly to offer a third dose to residents in those settings. Now, with the warm weather, we can certainly enjoy safer visits with friends and family outdoors in backyards or parks where physical distancing can be maintained. However, with the fall season in our sights and with the more transmissible Delta variant in our community, I'd like to encourage you to limit your close contacts in indoor settings where transmission is more likely to occur. As we are seeing Delta variant fueled resurgences occurring in other countries, we know we can impact the chances of that occurring here by our collective actions. And we've done it before. This means getting immunized if you haven't already, maintaining our public health measures, including masking and distancing, and limiting our number of close contacts, particularly indoors. Together, we can limit the extent of transmission in our community and protect those, including our children, who cannot yet be immunized. There are still plenty of opportunities to access the COVID-19 vaccine in Ottawa. Anyone who's eligible and wishes to get their first or second dose of vaccine can do so at any of our community clinics or neighborhood vaccine hubs. Drop-ins are available daily. Please visit ottawapublichealth.ca/COVID-19 vaccine for more information. And if you have questions about the vaccine, please contact your primary healthcare provider, or you can contact our public health nurses by phone at 613-580-6744. So thank you and happy to take questions.
Thank you so much, Dr. Malakny. I will now invite each media agency in alphabetical order to ask their questions. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question ainsi qu'une question de suivi. We will start with CBC Ottawa, Matthew Kupfer.
Hello. I hope you can hear me.
Yes, we can hear you.
Good. Okay. And that doesn't count as my question. So my question being, is Ottawa Public Health either on its own or along with other public health units asking the province to issue some kind of proof of vaccination card or mobile pass like we've seen beginning to roll out in Quebec and BC? And is OPH, well, I guess I'll let you answer that question first.
Yeah, no, I mean, certainly Ottawa Public Health is supportive of any policy that will increase immunization coverage in our city. You know, how many people are immunized is going to be a primary determinant, I think, about the potential for a Delta resurgence. Certainly, we've seen, other provinces put in vaccine certification programs. They're called different things in different places. And certainly the vaccine database, COVAX, which holds all the information on vaccinations, is a provincial database. And I think it makes sense for the province to be the policy lead here to do this kind of thing. I think our circumstance here in Ottawa is a bit unique compared to other parts of the province in that, Quebec is just across the river. And we've seen over the course of the COVID pandemic that anytime there's an imbalance in policies between Ontario and Quebec, people move accordingly. Sometimes it's, people from Ontario go to Quebec or vice versa. I think with Quebec introducing their passport system starting soon, my understanding is Ontario residents can go to Quebec and show their vaccination status. So that's going to have a net impact on our businesses where they're going to be potentially losing business. And, potentially unvaccinated people in Quebec who cannot access their non-essential venues will be coming here, which is a concern from a risk perspective for Ottawa. So I think for a variety of reasons, I think it would be helpful to have some kind of certification system here.
And I understand you saying that the province would be the lead. Sorry, can you hear me?
Yes.
I understand you saying that the province should be the lead on this. So far, what we're hearing from the ministry is, that the digital proof of vaccination or kind of the vaccination receipt that people have already is kind of what they're providing, and that it won't be. They don't seem to be saying that something more complete than that is on its way. But in Peel region, they are looking at providing issuing their own kind of proof. Is that something that Ottawa Public Health would be considering, perhaps even as a response to the unique situation that Ottawa as a border community finds itself in?
Yeah, I mean, I think, we have regular communication with our colleagues in other public health units, and we'll be interested to learn more about what Peel has in mind. Certainly the local business community, the Ottawa Board of Trade, for example, is interested in supporting local businesses. And they see the value in having some kind of a certification system, and they and other chambers of commerce have advocated to the provincial government. We're certainly here to work with the business community and look at local solutions that would be of assistance to them in the absence or until a provincial policy is enacted.
That's great. Thank you, Matthew. We'll move over to City News Ottawa with Eric O'Brien. Eric, over to you.
I had to unmute myself. Hi, everyone. My question is, so Dr. Etches, I think it was last week, said that mandating vaccines would be as a way to bolster vaccination rates in the community to get above that goal of 90%. But I'm curious to know if Ottawa Public Health has seen or what Ottawa Public Health's vaccination rates is right now today, and whether we've seen a spike over the last 2-3 weeks because there's been so much pressure from the federal government, the province, Ottawa Public Health, and organizations in Ottawa mandating the vaccine.
Yeah, no, thanks for that question. I'm just looking over in the corner of my eye at our dashboard. And of course, you can go on the OPH vaccination dashboard, which is updated continuously in terms of where we're at. I mean, if we look at the eligible population, that's individuals 12 years and over, we're at here in Ottawa, 85% have at least one dose and 78% 2 doses. I would say at this point we haven't seen a blip, but at the same time, I think a lot of what we've been seeing in the last week or two in the media are a lot of stories of plans to have policies versus them having been implemented yet. So we'll see, and we'll certainly monitor, and you can monitor with us by looking at our dashboard and the extent to which these numbers increase. Certainly, we've seen or we've heard of increases in uptake of vaccinations with sort of broader policies, but we do think it's important, basically, for every workplace to have a vaccination policy, to at a minimum be aware of who's vaccinated, who's not. To offer education, information, and opportunity for vaccination for people who are not yet vaccinated. Certainly, they can contact us, as I said in my opening statement, that we're quite willing to come to them and have a vaccine clinic at their site. The other thing is that as workplaces are making plans, I mean, I think the vaccine policy is important, but it's one component of what should be their overall vaccine safety plan, because with the potential for interaction amongst workers and then with workers in the public, I mean, we need to always be concerned about opportunities for transmission, especially with the Delta variant being the dominant variant here in Ottawa now. And so they need their overall plan as to how they're going to have screening and masking and distancing and all of these important components. And now with the additional piece of a vaccine policy. But at this point, to answer your specific question, we have not yet seen a blip. But as I said, the policies themselves haven't actually been implemented yet. So we'll certainly be monitoring that.
Thank you for that. My follow-up is just in regards to the third dose of vaccination. I mean, we kind of already knew that it was in the process, on its way, right? But I mean, is it something that we should be taking as like a cautious tale for the third wave coming up and for our most vulnerable population to get this third dose?
I'm sorry, Eric, could you just restate that just to make sure I understand the question about the third dose? What is the aspect of the third dose you're interested in?
I mean, we knew that it was coming, right? We knew that potentially we would need a booster shot of some sort. But I mean, we're at the start of a fourth wave, and this is specifically for our most vulnerable population.
Well, yes. I mean, I think it makes sense to be evidence-informed decision making with respect to vaccines and any other interventions. The science table that's been looking at this, has been looking at the evidence from places like England and elsewhere, where the protection for the overall population has remained quite good. Certainly even for Delta, the protection against serious illness and hospitalization has been in the 90+ range, and it hasn't really dropped. So for that, I mean, there's not really that need at this point for a booster for the whole population. It's really the concern is that either due to age, frailty, underlying medical conditions, where such individuals may not have had as big a response initially, or it's going to wane more quickly, that they're being prioritized. And so that's what we're seeing in the groups that have been announced as of last week and that we're implementing now. And the science table that's advising the province will continue to look at the data and we'll see what additional groups may get added over time. I think in the longer term, as they look at the overall population and what is being seen elsewhere, as well as here, as well as if we have other variants that show up, it's possible that we might be looking at some kind of a booster for the overall population. But at this point, it's the highest risk groups that's the focus.
Thank you.
Thank you, Eric. We'll move over to CTV News Ottawa with Joshua Pringle. Josh, over to you.
Thank you. Dr. Malakny, we were speaking with Dr. Remiliotis today at the Eastern Ontario Health Unit, and he said if the province doesn't introduce a vaccine passport, mandatory passport system, it would make sense for health units in the region to discuss a regional system. So Ottawa, Eastern Ontario, Leeds, Grenville, Renfrew. If the province doesn't introduce a system, would it make sense for health units in the region to look at a regional system for vaccine mandates?
We're always interested in having dialogue with our colleagues across the province, but also regionally. You may recall last year we came together, and it was the first ever media veil with all of the 4 medical officers in this part of the province, where we felt very, very strongly that we needed a masking in indoor public spaces. And so we did that here in Ottawa. We followed it by a bylaw. Since then, the province has put in regulations, and those regulations continue to exist for masking. But I think it's just an example where we work closely with our colleagues. Haven't had that particular conversation with Dr. Muliotis, but certainly could discuss it further. As I said, we also know our business community is interested in finding a local solution. And so certainly here at Ottawa Public Health, we're here to support. Overall, we want policies to be in place to encourage and support people to be vaccinated. We know we're facing Delta. We want the numbers to go up, and we'll be looking at. I've heard about Peel has introduced something, so we'll want to see what they're doing. Happy to have a conversation with Dr. Miliotis, and we can explore how best to pursue this in partnership with our business partners.
My follow-up question, do you worry that the clock is ticking on introducing some of these, like a vaccine passport, a vaccination certificate, like the clock is ticking and something should have been introduced yesterday before it's too late?
Well, from a prevention standpoint, you always want to be as early as you can. I think that we're at the early stages of a Delta resurgence where cases are kind of grumbling along and very slowly increasing. So, I think that we will be quite happy to have conversations with our public health colleagues as well as with the business community to look at what we can implement in the near future. Like a lot of things, the devil's in the details. These things sound easy; they're not so easy to do. I think it's more straightforward to do it centrally, as we've seen in some other provinces. But certainly, we're going to have continuing dialogue with our business partners, and interested to hear what our colleagues and other public health units are thinking in terms of steps that we could take.
Thank you.
Thank you, Josh. We'll move over to Global News with Craig Lord. Craig, over to you.
Hi there. Dr. Malakny, just following up on the third doses, I was curious about the doctor's note requirement for some of the immunocompromised people who are now eligible. Why is that measure in place? Are there concerns about people rushing to get a third dose who might not be eligible right now or might not necessarily be the people who need it the most?
Yeah, really the idea of the letter, either from their specialist or from their hospital program, is just an important step to make sure that we're getting these doses into the right people. So there will be a form letter that makes it easy for either the specialist's office or the hospital to be able to do this. And then it makes it easy for us at our end. When the person comes in, they show the letter, and we can just proceed. So that's what the province has identified as a process, and it makes sense for us. I mean, obviously for the long-term care homes and the higher risk retirement homes, the homes know who their residents are, and they're going to take the lead in providing the immunizations, and we'll work with them, provide them with the vaccine and any support needed for them to be able to implement in their institutions.
And just to follow up there, we have an initial group that's been named as eligible for those third doses. Where do you expect things to go from there? Is it similar to what we saw with the initial doses, where the next most vulnerable age groups will become eligible, other immunocompromised conditions, or is it, as far as you know, just these people for now, and we reassess after we've covered most of this population?
Yeah, no, my understanding is that the science advisory group that advises the province, have been looking at this issue, that this is the initial groups that they feel are highest priority, and they want to have the third dose in, and they'll be actively looking at what other groups will need to be added in the future. And so we'll await that direction from the province as to the groups that are next identified.
Thank you.
Thank you, Craig. We'll go over to Ottawa Citizen with Joanne Lashes. Joanne, over to you. Do we have Joanne on the line? Okay, we'll come back and loop back around. We'll move over to Ottawa Sun. Do we have Elizabeth Payne?
Yes, I'm here. Thank you very much. Dr. Malakny, there's quite a bit of concern already among parents about a repeat of last year's lineups, waits, difficulty getting testing and so forth once school starts. What steps are being taken in terms of making sure that there's testing space available for families and they're not spending hours all day in line?
Right. So here, our public health, of course, we don't operate the testing centers. We don't do testing ourselves. Our healthcare partners do this. And, since last year, there's been a testing task force, which has actually been a unique feature in Ottawa to share information and coordinate responses. I think the situation this September is different in a number of ways. Last year, we were in an environment where there were no appointments, so there's the long lines. There was also a very open policy that anyone who could get tested, that wanted to get tested, that added to the to demand. So I think this year we have built up testing capacity considerably, especially on the laboratory side, which was one of the limiting steps, that even if you had a test last September, it might be a long delay. And certainly from a public health perspective, we want those results back quickly so we can identify who's positive and ensure that they're isolating and the control measures are in place around them. So right now, the laboratory has the ability to handle many, many thousand more tests a day than they could have last September. There has been, we're hearing a bit more demand recently at the 3 test centers across the city, such that it's been a little more challenging to get a same day appointment. Although getting an appointment the next day has been straightforward. We're hearing from our testing partners that they're bringing in more staff to augment capacity. One of the other things that's going to be a little bit different this year that we're seeing already is that we're going to have other viruses in play, other respiratory viruses in play causing similar symptoms as COVID, which we didn't see last year. And so we're going to have more people with symptoms, and therefore, more people that are going to need to be tested to sort out whether they're COVID or not. We're seeing, increases in testing volumes right now, but not the same increase in cases. So that's reflecting other viruses in play, and the testing partners at CHIO and elsewhere are actually putting in a bit of a surveillance system to be able to track what other viruses that they're seeing. So bottom line is there's way more capacity and way more organization to the testing and lab components of the system, and in a much better position to be able to handle demand. The other piece, and I mentioned it in my opening statement, is there's going to be take-home kits, take-home testing kits in a number of schools as they start up. And what that will enable is actually to not need to go to a testing site just for the sake of testing. Now, if you've got worrisome symptoms and you need to be clinically assessed, then for sure. But if it's just an issue of you're a high-risk contact, for example, and you need to be tested, or you have minor symptoms and you need to be tested, well, these take-home tests, which is the same PCR test that's done at the testing sites, can be done at home, drop back off, and will go into the lab system and followed up, and avoid the need to actually go to the testing center. So that's another strategy that we're deploying this year, and should take some of the pressure off the testing sites, at least from the school-age children population.
Thank you. Can I just follow up on something you said earlier about the vaccine passport question? What concerns are you hearing from local businesses, and do they include unvaccinated people coming over from Quebec?
I think the concern I've heard from the business community is actually a loss of business of people from Ottawa going. I would say the unvaccinated is probably more my public health concern, that there'd be more unvaccinated coming into the city and interacting, posing a risk. Like most things, businesses like sort of a level playing field, and like clarity. We'll be continuing to work with the Ottawa Board of Trade, looking at options and how we can best support sort of any sort of ground up or bottom up kind of approaches to assist the situation, considering the fact that we don't have any sort of a vaccine certification program here in the province at this time.
Okay, thanks very much.
Thank you, Elizabeth. We'll pass it over to, et maintenant, on va passer à Radio-Canada avec Fiona Collienne. Fiona, c'est à vous.
Hi, hello, good afternoon. I've listened to all the answers in English. I was just wondering how comfortable you would be with answering, maybe having one quote in French regarding what you're hoping the province should do with this vaccination passport. Would that be able, Doctor?
Yeah, no, thank you for that. Unfortunately, I'm not going to be able to do that today.
Okay.
I hope to get to that point, and I can understand what's behind your question, but unfortunately, I can't. Certainly, the OPH media can assist afterwards, certainly providing something in writing or perhaps another option if you want to engage with them after this.
That's all good. But I got everything from the English. I was just wondering. I wanted to ask. Thank you. Thank you very much.
Merci, Fiona. Alors, pour une réponse plus précise en français pour n'importe quelle question que vous avez entendue aujourd'hui ou même pour les informations, nous préférons certainement vous fournir une réponse écrite qui peut être plus complète. Alors, veuillez nous envoyer un courriel à ophmedia@ottawa.ca après le point de presse. Merci. We will move over to Your Community Voice with Patrick Uguccione. Patrick, over to you.
Hi, most of my questions were asked, but I do have a general one, Dr. Malotny, do you have any concerns, does OPH have concerns that the level, it's sort of leveled off around 75% of 12 plus? I mean, I was in one of your mass vaccination clinics Saturday morning with my daughter, who luckily she's 11, but now can get it. And you could have shot a cannon through that. as opposed to the middle of the summer where there was virtual traffic jams getting into these places. Are you concerned at all that the the vaccination rate has leveled off?
Yeah, no, I mean, we've done well. I mean, you're right. I mean, for the eligible population, so 12 and over, we are at 85% with 1 dose and 78% with 2 doses. And, frankly, if we were dealing with the original virus from last summer, that would be great. Unfortunately, COVID has continued to mutate and adapt, and we're dealing with Delta, where these numbers probably aren't good enough, and we need to be higher. And you're right. I mean, we've plateaued to a large degree, and continuing to increase our coverage rate is going to be more difficult. And so we have transferred a chunk of our vaccination workforce to be working directly in neighborhoods, and we're utilizing a variety of strategies. We've got a number of neighborhood community vaccine hubs that are in neighborhoods that have the greatest barriers to immunization. And so they'll be sort of a static kind of footprint that's dependable to be there for people to utilize. And then we've got outreach team of community developers that will be working with community groups and going directly to where people live and work and say, hey, do you have questions? Do you want to be vaccinated? We have nurses on site here, come on out. So we'll have, those kinds of neighborhood strategies. And then we also have our initiative about having mobile vaccination teams. And so that's, and they're pretty well out every day. And whether it's at workplaces who want to increase their vaccination, or places of worship, or community groups, teams, what have you. All people need to do is give us a call or go on our web, and we're happy to be engaged them. We can scale. I was speaking with business groups, and one business owner was saying, well, if it's only a few people, I mean, should we even bother calling you? And I said, you know what? Give us a call. We'll chat it over and figure out what makes the most sense. We can scale. Whether we're doing a small workplace with a few people or a huge warehouse with hundreds of people, we can scale up to the need. So those are just a taste of some of the things that we're doing. The other thing I would say is that the mobile clinic model will also work for schools. In September, when we have a better sense as to the vaccination rates and eligible children in schools, we can work with the school community to have a clinic near the school or in the school to be able to provide an opportunity for vaccination. The other thing I would say, though, is that we're at that point where policies are going to be important. And so we're really pleased to see a number of organizations and workplaces in the city putting in place vaccination policies, which will be an additional mechanism and incentive for people to get vaccinated. It will also provide protection for that institution or workplace, with the additional benefit that it's not only help protective for that setting, but also wherever they live and other places they visit. So there's a few prongs, that we're going to be pursuing in the upcoming weeks and months. It'll be harder work than earlier on when we were, doing tens of thousands of these things a day or more. But at this point, we just got to keep nudging up the coverage rate a little bit each day, one arm at a time, to be able to protect the people of Ottawa. And then later in the fall, we don't know exactly when Health Canada will approve a COVID vaccine for younger children aged 5 to 11, but that will be an important other major milestone where we can offer a vaccine to that age group to protect them.
And just as my follow-up, you mentioned the vaccination policies, and I'll use the Ottawa Red Blacks as an example. I think they can have upwards of 15,000 people at their first home game. How confident are you that everybody going through the stall that day is actually going to show, proof of vaccination or a recent negative test? I mean, can they actually have that much staff at the turnstiles to check 15,000 people?
I mean, that's a question probably better suited to the Red Blacks organization and OSEG, who actually owns them.
Is public health working with them?
We've certainly been in communication. We are certainly working with them. We've actually already started running vaccine clinics with them, and we will continue to do that up to and including game day. Basically, we'll go anywhere to any group that wants to have us as a mobile clinic, and so we will do so. I could see for them like there are some logistical challenges. Talking probably to other pro sports venues who are dealing with similar issues is always a good idea as to how to actually organize that kind of thing. But we've seen, some music festivals and other settings that have been trying this out. So I think there will be an opportunity to learn. This is, another example, though, instead of having to try and sort this out by every business for every kind of scenario, that, having, a single policy and a single process and a single, quality source of information on vaccine status would be of assistance to many businesses, and I think that's why the chambers of commerce have been advocating, as have the mayors of the big cities, to have some kind of a vaccine certification system to make these kind of situations easier for the individual operator.
Great, thank you very much.
Thank you, Patrick. We'll move over nous allons passer maintenant à 104.7 FM Outaouais avec Caroline Bertrand. Caroline, c'est à vous. Do we have Caroline Bertrand on the line? Okay, well, I believe that we've addressed all of our media that have registered today. Je remercie tous les médias. If you do have any follow-up questions, please don't hesitate to reach out to our media team for a written response. Je vous remercie à tous. Thank you all. This concludes our press conference for today. Merci. Bonne journée.
Thank you.